Let's bring in Dr. Carl Heneghan, the GP and Director of the Centre for Evidence-Based Medicine at the University of Oxford. Thanks for joining us, Carl. Could we get your thoughts on the fact that it seems to us and to all observers that this inquiry doesn't seem to be asking what I think the crucial question should be, the central question was not, should we have locked down earlier? Should we have locked down more extensively? All valid questions. But why isn't this inquiry asking, should we have locked down at all?
Yeah, because I think it's been confirmed somehow it's investigating government decision-making without looking at the evidence for those decisions. And a classic example of that was, for instance, yesterday when they talked about the Eat Out to Help scheme. And the claims were, you didn't tell me, and it was obvious it was going to increase infections and transmission. Well, actually, if you start to look at the data and look at the evidence, actually that is broken down pretty quickly. Because actually, if you look at what happened in August, it was only till mid-September, some 2 weeks later, that infections started to rise. And also across Europe, if you compared across Europe, infections were rising in Belgium, in France, in Spain. Oh, and you know what? They had no Eat Out to Help scheme. So I think what's going to happen here is Aubrey said they're going to look at the evidence. I'm not sure unless they bring a new module into place that says we're going to investigate the modelling and the evidence underpinning the decision-making. And that would be an additional module that has to come on board because as the current remit of this module is, there's no looking at the evidence. And that is, I think, a huge oversight, but that's where we are. And that's why nobody is questioning and saying, what evidence did you use for that statement at this moment?
Yeah, and this is so critical in this. I mean, the public really needs to know how decisions were made and to make sure the government haven't invented a big red lockdown button for the future. Now we can see how injurious it is. But my understanding is that you have submitted evidence to the person who called the inquiry and don't think that she's particularly bothered to look at it. And yet Chris Whitty today again has pointed out how close the working relationship was between the SAGE advisors and the World Health Organization. What does it feel like, someone with your expertise, preeminence in your field, to essentially sort of be dismissed at the same time as an unelected body in Geneva with close connections to China being one of the lead decision makers for what happens in this country?
So I would say I'm not being dismissed because out there in the populace and out there in the public is a huge swathe of individuals and people who are really interested in what does the evidence say. There's a broad church of publications that are writing now asking the same question. I think there are people who are defending their positions and the status quo, which the issue is we're supposed to be learning lessons. So if everybody just looks at it and says, well, I never made any mistakes, it was over there, then what are we supposed to learn from this apart from the government was dysfunctional and many other people jumped ship and are now have left the situation? What lessons are we going to learn if nobody says, yes, in these situations we made errors or there was uncertainty? Now, I do think today Chris Whitty has had some questions that opened up that sort of chasm. This idea, because I think the issue is, because he's an actual doctor, he talked twice about the decision-making in terms of patients. He talked about the benefits and the harms. And I think it was clear what they were alluding to is that SAGE was such a narrow group of people. Many on that committee didn't understand the broader picture of, oh, there were going to be harms. And that changes radically the decision you may take next if you've got the full information in front of you. So I think a broader church that actually helps people make an informed decision would have been much better. And I think actually that's been alluded to today. And that is the sort of tactic, I think, of the KCs, is to broaden it out in the light of what people have put in written statements.
Carl, you and many like you, many people who signed the Great Barrington Declaration, which queried, shall we say, the COVID orthodoxy, that we all had to lock down and shelve our lives for 2 years. All of you who questioned that were demonised by the establishment, if you like. You were characterised as cranks and weirdos. Now, there are a significant number of them. Look at your job in itself. You are the Professor of Evidence-Based Medicine at the University of Oxford. Why were you characterised as a crank?
Because it's in the face of certainty, when you come in with an evidence-based approach and start asking questions, it creates a lot of anxiety against those people at the top. And when they've nailed their mask to the colour, it becomes very difficult to let in the uncertainties and go, many of our policies we're about to enact, we haven't clearly understood whether there's any evidence. That's okay, you can take the policy, but we should have been much clearer to say there's no evidence informing the rule of six, for instance. When we're looking at children, we've got no evidence. When we're looking at all of these features, actually, we're not even developing the evidence. So it's surprising to the public when I say an evidence-based approach always proves controversial, because what you're trying to do ultimately is inform the decision. And it's key when you don't understand or you're uncertain, you have to express that uncertainty. So there are many things we did that were coming based on modeling as though it was de facto certain this is what's going to happen. A classic example yesterday was the death graphs. There's going to be 4,000 deaths. And immediately we looked at that and said, well, actually, that doesn't reflect what's going on in the real world. That was an error. But by the time it was admitted to be an error, it had already been presented to the public, it was already in the media, and we were in the midst of our second lockdown. That's the consequences of not having another side in the debate. And I think that's incredibly important in a democracy. If you want to know what it's like not to have dissenters, you can just travel to China and see what happened there. And that's the best example of what you get if you don't have people who speak out.
Yeah, I mean, it did feel like kind of an authoritarian approach. I admit I became an armchair epidemiologist during the pandemic, as a lot of us did, and sort of thought, well, it doesn't make sense to lock up healthy people. And yet it seemed to me scientists were spending more time looking down microscopes and looking out the window and seeing what was actually happening and realizing that people were catching it and were totally fine. I mean, what do you think the biggest questions are that now need to be answered by this inquiry to stop us going down this sort of absolutist route again in the future at the next possible health scare?
Well, look, just first thing is to say, it's great, Alex, that you're interested in evidence-based medicine. Just as we said, you want to be informed about the decision-making. I think there are huge questions. Look, we haven't even touched, but it is going to be another module, for instance. All of these lockdowns had no provision for care homes, where 40% of the deaths occurred in the first wave. We spent 37 billion on a test and trace program. Policies changed 200 times in 2020. Nobody even understood the policies or could get their head around them. And by the time you did, they changed again. So it's right to look at the impact of these policies and start to go, why did we have a pandemic preparedness and then we abandoned all of those plans on a whim? Who had skin in the game to make that change from policies that have been in all of the previous pandemic that did not involve a Chinese-style lockdown? That's the key issue. And then looking at the round, the 400 billion that we spent, what value, and importantly, what do we know what that works right now? In what context? For whom? What are we going to say specifically? This is what we will do different next time because there's a clear evidence base. And that is a key question that needs answering.
Yeah, well, let's hope those questions are asked and indeed answered.